Hello, I'm Jack Tracy, and I'm with the Jordan Smelsky Foundation for Amoeba Awareness. We're here today at the Amoeba Summit, the fourth annual one, 2019. And with us today, so graciously, he's allowed us a little bit of time to answer a question for us. This is Dr. Juan Dumois. He's an infectious disease physician at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. So, wanted to ask you, Dr. Dumois, since primary amoebic meningoencephalitis, or PAM, is so often misdiagnosed in the ER, what measure or measures do you think could be instituted, or perhaps may already be instituted in some hospitals, that would be a way to ensure that it is not misdiagnosed?
Yeah. Well, we have done some work on that, because when a patient comes in with symptoms of meningitis, headache, stiff neck, fever, Naegleria fowleri is not usually the first thing on a clinician's mind. Mm-hmm. And so we often need a reminder. Mm-hmm. We also know that it is crucial to make the diagnosis very early for the patient to have any chance of surviving, and it is possible for patients to survive with normal neurologic outcome, but you have to diagnose them in the first 2 or 3 days after the onset of symptoms. So a working group that was initiated here at the Amoeba Summit a couple of years ago started working on that and created an algorithm and a full protocol. So here's how it works. When a patient shows up looking like they have meningitis, the clinician orders a spinal fluid culture after having done a lumbar puncture. When the spinal fluid culture is ordered, then the electronic medical record automatically pops up a window that is an alert asking, have you asked about fresh water up the nose in the previous 2 weeks? So it's a reminder that Naegleria is found in fresh water. The fresh water has to have been up the nose, and the incubation period is up to 2 weeks. And if the answer is yes, or maybe, then there's a prompt to immediately order the correct test of the spinal fluid, because routine testing of spinal fluid will not detect the amoeba. So if the amoeba test is ordered and is done immediately by the lab personnel, the diagnosis can be made within an hour. And then the treatment can be instituted within that period of time as well, and greatly improve the chance of that patient surviving the infection.
Wow, that is fantastic. We hope that hospitals nationwide and worldwide will adopt that type of electronic alert.
Yes, we also created an order set. So that is a screen in the electronic medical record where once you've decided this patient might actually have PAM, you pull up the order set and it automatically tells you everything you need to do, consulting certain specialists, the different medications that need to be started, the doses, how to administer them. It's all prepared. And we are happy to share the full protocol and order set with anyone at any hospital that wants to start using it. And even if they receive our protocol, it will require some adapting for their own electronic medical record. Mm-hmm. But at least this is a very helpful start that can avoid months of work trying to create it from scratch.
Mm-hmm. Yes. And if I'm not mistaken, there's also a number that the physician can call at CDC for consultation.
Yeah, that is the CDC Emergency Operations Center. Mm-hmm. That line is staffed 24/7. And that can be called for any questions about diagnosing or treating patients with PAM.
Wow. The number is 770-488-7100, I believe.
Sounds good.
Yeah, okay. Well, thank you so very much for your time today, Dr. Dumois, and thanks so very much for all you did and your work group to develop the algorithm and for promoting the institution of that alert in your hospital.
You're welcome.
Thanks
and thank you, Mr. Tracy.
Thank you.